Good afternoon and welcome to BDO Live. I am Ellis Dean, a senior project manager with blackdoctor.org. And I am very excited to be with you here on this Sunday afternoon to kind of talk to you about a special program that I know that some of you have noticed that we have been running on Black Doctor. And I want to introduce to you some special guests that we have with us today. But first of all, I want to talk about, and I don't know if you all have noticed, but we have had a series of videos that we've been running on blackdoctor.org called Medical Moments. And those moments are we're working with BMS, which is Bristol Myers Squibb, and we decided to create a series of videos that are coming directly from doctors, speaking directly to you, the audience. And so we tried to eliminate all the middleman, all the fluff, and have our doctors prepare some videos directly to you. The videos are about the misinformation that is circulating around about COVID and the coronavirus and all of the things that we've read on the internet. The internet, it can be a great thing in that it presents a lot of information at our fingertips, on our phones or on devices, but it also can be a bastion of misinformation as well, and especially medical misinformation. And so what we wanted to do was create some videos that are coming directly from special doctors from around the nation, speaking directly to you, talking about this misinformation. We called that video series Medical Moments, and we've had a number of videos out there talking about mental health, talking about testing and screening, talk about family gatherings. And from the responses that we've been getting, we've had over 100,000 people reached by these video series, and we're continuing to do some more. The best video so far has been created by two doctors. Typically, we had doctors that were doing them solo, but this time in this, we made a special occasion, a special exception for two doctors. And these doctors are sisters, and they created a video. And not only are they sisters, but they're twin sisters. And we just wanted to have them come on today to talk about what they did, who they are, and so you can learn more about the twin sister docs, which is what they're known as. So I'm going to bring them on. I'm going to shut up because you need to learn more about them than from me. So first up, we have Dr. Elena McDonald. Sorry. Hi, how are you?
Hello, good afternoon, everyone.
And we have a second version, which is Dr. Delana Wardlow.
Good afternoon, everyone.
How are y'all doing?
We are doing well. Thank you for having us.
Well, thank you for joining us. I just want to start off with this, is that picking a career for any of us is hard. I've had several in my lifetime. And so for you to pick the career together kind of makes it doubly as hard. When did you decide to become doctors?
So for me, I decided to become a doctor in high school when I realized that our maternal grandmother died of breast cancer when she was 53 years old. So that sparked my interest into becoming a physician and realizing later on that she had died from a condition that had been detected at an earlier stage. She may have lived another 30 years of life. So that was really the turning point for me, realizing that grandmom died at such a young age. I mean, she was 53. I mean, I'm not going to say my age, but it's very close to my age right now. And so that really was the driving point for myself.
And for me, medicine actually was not my first choice. I actually thought I wanted to be an attorney. And I had gotten a summer job in a law office, and I was a file clerk, answering phones, going down to City Hall to file petitions and things. And I quickly realized that I did not want to do that. And so exposure was key because I thought I wanted to go one pathway. And then I decided, no, that's not the pathway. And then as I thought about it, I was getting ready to go to college. I said, okay, what do I want to do next? What am I interested in? And at that point, I knew I wanted to help people, and I knew I loved children. So I said, okay, pediatrics, let's go be a doctor. Let's be a pediatrician. And what really, really, really solidified it for me was after my freshman year in college, I had the opportunity during a summer internship to rotate with a group of African-American physicians throughout the entire summer. And it was every specialty, and some of those physicians are still my mentors today. But at the age of 19, I was able to see live and live in color African-American physicians that looked like me practicing medicine in my beloved city, and that solidified it for me.
So we got one that made a decision in high school, the other one made a decision later on. When did y'all talk about that?
You know, we really didn't talk much about making the decision as to go into as to what we were going to do. We really didn't have a conversation as to how we were going to proceed in our careers. We did go to the same undergraduate school. We did take the same core courses. So when we finally made when both decisions were made, we were already jointly bound. We were already taking all the same classes, and we just continued with our pre-med prerequisites.
And ironically, Dr. Warlaw and I, we did everything together. Mm-hmm. So we just assumed that all twins went to medical school together. However, when we showed up to medical school, there were about 4 or 5 other twins in our class, but it was only one half of the set there because the set didn't get to the same school. So they split and went their separate ways. But so we were blessed to be able to go to the same medical school and support each other throughout that process.
Well, talk to me a little bit about that process, because I know, my best friend in high school and in college, we were together so much that people started mixing us up, and they were calling me his name and him my name, and we worked really hard. It didn't bother us as much. We worked hard to try to differentiate ourselves. Did you feel the need to do that when you were in undergrad and in medical school, or was it just, this is my sister and we're rolling with this?
We didn't find that need to do that. We spent most of our time together. We had the same classes, so we were together most of the time. So, and people mixed us up then, and they continue to mix us up now. I mean, I'm called Dr. McDonald every single day of my life, and it doesn't affect me or it doesn't bother me at all. People apologize to me for saying that. I'm like, it's okay. That's my sister. It's not a problem at all. But once you get to know us, you get to know our personalities. It's very easy to distinguish us.
Got you. So
and
what was it like? Go ahead.
In general, people have the tendency to compare twins.
Mm-hmm.
So they expect that you're going to do the same thing. And, and at some point, some of the questions were, your sister got married, or you getting married? And it was like, no, we're not that similar, but we're extremely similar.
Yes.
Okay. So, what was it like growing up for you two? I know you mentioned that your grandmother was your inspiration for going into medicine. What was life growing up? You are Philly natives, correct?
Absolutely. We were born and raised in North Philadelphia, an area that has been challenged economically. It has a high poverty rate, has a high crime rate, and that's where Dr. McDonald and I were born and raised. We were fortunate enough to have parents who were pivotal in making sure that we received a quality public school education. We couldn't afford private school, but my parents were they were advocates, and they taught Dr. McDonald and I how to be advocates for ourselves and to advocate for our community, because they were our first examples of advocates. And they quickly realized that the quality of education was dictated by the zip code. And my parents fought to make sure that we attended quality schools. And I'm forever grateful for my parents for recognizing that, and not only recognizing it, but doing something to change the tide. And that was instrumental for us.
And to piggyback on what Dr. Warlaw is saying, we did grow up in one of the most impoverished neighborhoods in Philadelphia, but we lived on a small street. Everyone knew each other. Everyone knew each other in the neighborhood. And you knew all eyes were on you. So even if your mother and father wasn't home, mommy and daddy wasn't home, you went out that house and you misbehaved, Miss Green will say something to you. Across the street will say something to you. Miss Novella will say something to you. And then when your mother comes home and your dad comes home, you're in trouble again because the village has reported on you. So we lived in that small, that tight-knit street. And we would all go outside and play every day, jump rope, kick the can, red light, green light, hide and go seek, all of those things. That was our childhood. And our parents protected us, Ellis, where we really didn't know how economically challenged our parents was until we were practically adults. So our parents really sacrificed to make sure that we had the necessary things that we needed.
Well, that's I'd love to meet your parents because we need more parents like that out there really understanding, because, kids don't need to know about financial hardships and things. So if they did a good job of protecting, it sounds like they did, of protecting you from that, you're able to have a more free childhood and not be burdened by adult kind of, stressors and things that can weigh us down as adults. So you were able to go on and excel and reach your full potential because you weren't worried about those type of things. I will say this though, so some of those games, I don't think they play anymore. So you dated yourself just a little bit. Red light, green light, which I played in my time. So I had exactly what you're talking about with those games. So, all right, so you get off, you go to Temple for undergrad, and then both of you go to Penn State for medical school. And then you make the decision after completing medical school to go back to Philadelphia, where you're from. Why did you make that decision?
Well, that decision made. Go ahead, Dr. McDonald.
One, for me, it was, I knew I was going into a residency program. Residency programs are extremely, extremely strenuous. Mm-hmm. And I wanted to be somewhere where I had support. So I had my family, I had my friends, I had who would eventually become my husband, all back in Philadelphia. So it was natural for me to go back home where I had the support. And it was also natural for me to go back home and to the neighborhood. North Philadelphia, St. Christopher's Hospital for Children was in North Philadelphia. So it just made sense for me to go back to continue my training and also help the community.
Yes, and it was important for me also to be able to go back to the community that basically helped raise us. The community played an instrumental role in Dr. McDonald and I being able to reach our goals, family members and friends taking us to the library and making sure we had books. And so the community played a huge part in helping us develop into who we are. I felt, I don't want to say obligated because I didn't feel obligated, but I felt that it was, I needed to go back to give back to those who worked so hard to help me get to where I am today.
Absolutely. Absolutely. So you go back to your hometown, your home community, you're there practicing, and then you'll develop this 3T philosophy. I'm going to call it philosophy, but you developed the 3 T's. Could you explain to our audience what those 3 T's are and how they guide your practice every day?
Absolutely. So the 3 T's are trusted messengers, which translates into action, which leads to transformational outcomes. So what that means is that we know that the African-American community has, not all, but some people have mistrust with the medical establishment for valid reasons. And we also know that mistrust oftentimes prevents us from getting the care that we deserve or that we need. So Dr. McDonald and I recognize working in underserved communities all of our careers that if patients are receiving information from someone that looks like them, someone that is culturally sensitive, then they're more inclined to receive the message from someone that they can relate to. So we quickly realize that the message has to come from a trusted messenger. Otherwise, it's very many people will not hear the message. So if patients are hearing the message, they are interpreting the message, and that empowers them to be able to understand what's going on in their healthcare, become team members and active participants in their healthcare, becoming advocates for their healthcare, which ultimately leads to increased compliance. With increased compliance, that allows for better management and control of chronic diseases, and that leads to transformational outcomes.
Yes. At the end of the day, if you don't trust the messenger, you're never going to hear the message. And we recognize that, and we want people to, one, be able to have a great relationship with their physician where they're able to ask questions and advocate and say, listen, I don't understand. And they feel comfortable saying that they don't understand. Because at the end of the day, if a patient has left my office and their parents or them, if they're older, they don't understand what I have told them, I haven't done my job. I have not done my job. And if they don't understand, then I need them to feel comfortable saying, Doc, I don't understand what you told me. And some people just don't feel comfortable if there's someone that doesn't look like them. So that was important. That was important for us, because at the end of the day, we are suffering at such higher rates, with morbidity and mortality across several disease processes, heart disease, obesity, high blood pressure. So we want people to feel comfortable enough with their physician to take action in their care. And that leads to the transformational outcomes, as Dr. Wardlaw just said.
Absolutely. Well, I love the 3T philosophy. I think it is definitely what is needed in our community. And you're absolutely right. The research supports that Black patients are more adherent to to their doctors' prescriptions and commands and follow up when it's coming from a Black doctor or even a doctor that's culturally sensitive. That really takes the time to understand who they are and how we are as a people. And so if we can do that, that really helps break barriers. And so I applaud you two for going back into the community, because a lot of times, you two could, it could easily say that you made it. And I mean, use air quotes on that. We hear all that. Man, you're a doctor. You can go and do whatever you want to do. You can practice wherever you want to practice and then live a good life. And you all both said, no, we can do that, but we can do it for my community as well. And living a good life means serving our community. And so thank you both for that.
And absolutely. And Alice, if I could say one more thing, my practice is a very diverse practice. So
Okay.
I've had to learn how to connect not only with my African-American patients, which was much easier,
Right.
I also had to learn how to connect, with my Albanian patients, my Caucasian patients, my Latino patients, my Vietnamese patients. I had to recognize the cultural barriers that were there between myself and them and learn how to bridge that gap.
Right.
So it's very important that you're able to make that connection with all of your patients. And at the end of the day, what I have strived to for my patients to understand is that ultimately I am here to help you. Ask me any questions that you have, because my job is to make you have a healthier life, to help you have a healthier lifestyle.
Absolutely. Dr. Warlaw, do you have a diverse practice and you had to have those same challenges, or are you in the community and seeing mostly people from the community?
So I'm in the community. I'm seeing most of my patients are African-American patients because I am a family medicine physician. I see all generations. I see multiple generations of families, which also helps to address some of the social issues that arise. And again, you have to realize, again, working in the community, you have to realize there are other things going on, social determinants that are going on that are affecting people's ability to sometimes be able to understand what's going on in their health, or preventing them from following the guidelines or the recommendations. And you have to be culturally sensitive and be aware of those things. And my patient population is mostly African American.
Okay. Okay.
Mm-hmm.
So, when we talk about healthcare disparities, and the coronavirus and COVID has really shown a really bright light on those disparities. We're talking about African Americans, Black Americans having, 2.5 times the death rate when they get COVID as with their white counterparts. We're seeing it's really kind of because a lot of times we have multi-generational households, and we know that elderly are more susceptible to this particular disease. We've got, children that might be interacting with others because they have to go to school. And so their contact tracing might be increased as a result. So now we have, coronavirus has really shown a big, big light on healthcare disparities. So, but I guess the question is, how has this affected your mission to be able to create transformative outcomes?
Well, really, Ellis, COVID shine the light on it. But Dr. McDonald and I have been aware of all these years that we've been practicing medicine, and so now that it's definitely better that more of the world is becoming aware of these disparities that exist in medicine. A big cause of this is lack of access to care. We have to make sure that our government officials are increasing that access to care. Aside from all the things that you mentioned in regards to the coronavirus, we know that another thing that coronavirus showed, that if you don't take care of your chronic illnesses, then you were at risk for developing complications of coronavirus. So that lack of access to care, which prevents patients from being able to see a doctor on a regular basis, diagnose conditions at an early stage, get those conditions under control and maintain those conditions, that put them at higher risk. So for Dr. McDonald and I, we have been working to address that on various levels in our practices and in our communities. But COVID helped people to understand that more. People to understand, like, listen, if you don't have your diabetes and your high blood pressure under control, and you get COVID, then you're likely to develop these complications and or death. So the COVID situation, unfortunately, helped shine a light, which is helping people to have a better perspective of what is exactly is going on with their long-term health care.
Absolutely. So let's talk a little bit about vaccines. Dr. McDonald, you're a pediatrician,
Yes.
and you've been dealing with vaccines since you started your practice. Why do you think it's so hard for people to understand that a vaccine that's being created now is the same as MMR or other vaccines that we take routinely and that people don't even think about? But now there's been so much controversy about this vaccine. Why do you think that is?
So one, I think just in the overall grand scheme of things, the way that it was rolled out, I think that it created a lot of trepidation for people, because when you say that we're going to create a vaccine at warp speed, people automatically start to say, okay, well, if you're rushing the process, then what parts are you skipping that's going to make this vaccine unsafe? So we people have to realize that when they say warp speed, it just meant that typically when you roll out a vaccine, it could take a few years because it's a stepwise process. For warp speed, they did a lot of the processes consecutively together. Mm-hmm. So the other thing that some people just have a genuine mistrust of the medical system and of the vaccines. And it's important for people to understand how the vaccines work. We're not injecting you with a virus. We are injecting you with essentially a blueprint so that your immune system, which works off of a memory, your immune system can see what looks like the virus, but is not really the virus. And then it could create the antibodies, which is your defense. So basically, I tell people to think of a vaccine as a way of building an army. Building an army. You've seen the enemy's plans. Now you've built your defense. So when they come, you're ready. You're ready. So if you don't get a vaccine, your immune system may figure it out. But as your immune system is figuring it out, you could get significantly ill and you could possibly die. And that's why the vaccine is so important, because with this pandemic, we have seen hundreds of thousands, and the United States alone die, millions across the globe within less than a year. So the social distancing and the washing the hands that we have tried has not been enough. So vaccines are tried and true. They go through a strict process to make sure that they are safe and effective. And at the end of the day, the vaccine or anything that we're offering you, the benefit must outweigh the risk. If the benefit does not outweigh the risk, we should not be having a conversation with you. And when we talk about vaccines, yes, the side effects, people worry about the side effects. So almost every vaccine, any vaccine that you give, has documented side effects because they all have gone through these clinical trials. And those side effects can be fever, it could be headache, it could be body aches, and those things are far less than actually the complications of coronavirus. So you have to look at it like that. The vaccines are tried and true. We've been doing these vaccines for over 70 years, started back with the polio vaccine.
Can I say something, Ellis? I also would like to say that I think a big part of the conversation that's being missed is that many people think that the vaccine just started being developed in 2020 with SARS-CoV-2. However, the technology that is being used, the messenger RNA technology for the two vaccines that have been approved for use now, that technology, the scientists and the researchers started working on that after SARS-CoV-1, which was the outbreak in 2003. So what many people think that all of the work for the vaccine started this year with COVID-19, and that is not the case. They've been working on this messenger RNA technology for years. What had to be determined was the genetic makeup of the SARS-CoV-2 or COVID-19 virus, so that we could have an effective vaccine. But the technology has been worked on for several years.
Absolutely. Absolutely. I had to learn that myself. I promise you, I have been learning so much about the COVID and vaccines and the body's response to them. I'm going to take the MCAT next year. So
we're ready.
We're ready.
Yeah.
But speaking about that, as medical professionals, we know that they've had some rollouts, initial rollouts, and people have started taking it. I produced, we did a Facebook Live the other night and talked to Dr. Wayne Fredericks, who is the president of Howard University, and he's already taken his first dose. He's one of those people that has comorbid conditions. He has sickle cell and he has diabetes. And so have you been offered the vaccine, and are you going to take it if it comes your way?
I have not been I have not been given a date and time to receive my vaccine yet. That will come, and when I do receive that date and time, I will be there with bells on, Ellis. I will be receiving my vaccine. I am far more concerned about complications of COVID than about side effects from the vaccine.
Gotcha.
And to echo what Dr. Wardlaw said, when I get the call to come and get my vaccine, I will absolutely be there.
And we have to take the vaccine not only to protect ourselves and our families, but we have a duty to protect our patients. So we have to make sure that we are doing what we can to make sure that we are decreasing our risk of contracting coronavirus and spreading it to others. So we have a due diligence to our patients as well.
Absolutely, absolutely. So I think that do you think we put too much emphasis on the vaccine and COVID, or should we just be kind of focusing on more about the big picture of really trying to regain the health of our community and getting control of COVID as being one part of that puzzle of regaining the health of our community, which means staying on top of asthma and diabetes and heart disease and all those other things? Because so far, what I've seen is COVID has kind of been put off to the side, and then we've been focusing so much on that many people have really kind of lost sight of the other conditions that are affecting our community. So do you think we should put COVID in with all of the other things, say, okay, we got to treat all of these things as a problem for our community and not just COVID separately than everything else?
We have to be able to do both. We have to be able to do both. I always say unfortunately, we've had to learn how to live within the pandemic. So we want to make sure we're still doing the things that we need to do to take care of our health, making sure that you're going to your doctor's appointments. Now there's an option for telehealth. Some visits can be done by telehealth. Some visits cannot be done by telehealth, but doctors' offices and hospitals can put protocols in place to protect the patients and the staff when you come into the office. So it's important, as a pediatrician, we still need our children to come in because we're monitoring their growth, the mental, the physical. We need to make sure that they're getting their childhood vaccines. We want to make sure that everything is still moving along. The purpose of what we call well child checks is to really identify a small problem before it becomes a huge problem. So we want people to continue to try to maintain their basic health care. And I'll let Dr. Wardlaw talk about the screening procedures for adults.
Absolutely. We have to make sure that we are identifying medical problems, maintaining medical problems, and making sure we are keeping diabetes, high blood pressure, heart disease, lung disease under control. Not only are we maintaining the chronic medical problems, we have to still be able to identify acute medical problems. And we also have to make sure that we are still encouraging patients to get their preventive screenings, because we did see during COVID, well, initially we recommended that people not go and get these screenings done. But now that we're living within the pandemic, we are still encouraging people to get their colonoscopies, make sure they get their mammograms, make sure they're seeing their GYN doctor, because again, we are living within this pandemic now. The hospital have taken extra precaution to make sure they have separate entrances. They're screening people to make sure that people who are maybe potentially at risk for coronavirus, they are having them go to different exits and entrances and things of that nature. So the hospital has taken extreme measures to make sure that we are protecting our patients. So we're definitely encouraging people to not only visit their doctors for their routine care and maintenance care, but also for preventive measures. Again, my grandmother died at 53 of breast cancer. Had that been diagnosed early, she may have lived another 30 years. And that means getting your preventive screenings.
Right. We finally get on the other side of this pandemic. And, your diabetes is very, very, very poorly controlled at that point.
Right.
Or there was a mass that has grown over time that could have been picked up on a mammogram months before, or there's a polyp that you have, in your colon that could have been picked up by a colonoscopy. So it's very important that we have to be able to do both. Yes, we have got to slow this pandemic, but we still got to be able to make sure we're maintaining our health as we move along.
And one other thing, Ellen, in regards to emergency room care, there are a lot of patients who are not reporting to the emergency room for a fear for exposure to coronavirus. We don't want that either. We want, if you are having symptoms of a heart attack and or of a stroke, or if you're having, if relatives are noticing changes in your mental status, or you have extreme weakness, or you have the worst headache of your life, we don't want you to sit home and suffer with these emergencies, with these emergent symptoms. You still have to report to the emergency room for emergency symptoms that have to be treated emergently. We have been seeing a lot of people who have not been reporting having strokes, heart attacks at home because they were afraid of exposure of coronavirus at the hospital.
Absolutely, absolutely. So if you're just joining us, we are talking to Elena McDonald and Elena Wardlaw, also known as the Twin Sister Docs. So you can follow them across social media at Twin Sister Docs. And so they are here blessing us today. We talked about their Medical Moments video earlier today. And we had a question from the chat room. He said he joined us late. This is from Lucky. He joined us late. He wanted to, if you could reprise and let people know again what the 3T philosophy is.
Oh,
Absolutely.
okay.
So the 3 T's stand for trusted messengers. That's going to give you accurate information, and that will translate into action, which encourages individuals to be advocates for their health care. And that ultimately leads to transformational outcomes and improving overall quality of life.
Absolutely. Dr. Wardlaw couldn't have said it any better herself. Dr. McDonald, as a pediatrician, we know that the vaccine has not been approved for people under the age of 16. How do you talk to parents about how they protect their children and that, or those children that are on that age 16 line of demarcation for the vaccine? What messaging are you sending to parents to say, okay, well, you should probably take the vaccine? How do you tell them also to protect their children?
So one, I tell my parents, as I tell all of my parents, I need you to be 100% or as close to 100% as possible to be able to take care of your child. So for me right now, that means if when the vaccine rolls out, you need to consider getting the vaccine. Also, as far as children who are under 16 and are not eligible to get the vaccine, we're still going to continue to do the same thing, which we all have to do because the vaccine is not being rolled out at one time to everyone. You're going to have to continue to practice the social distancing, wearing your mask, washing your hands. So we're going to have to continue those things for quite some time as the vaccine is rolled out. Now, they're going to lower the age for the trials for the children. So eventually the vaccine will become available to younger ages. But right now, it's 16 and above or 18 and above, depending on the particular vaccine. So we still need to stay the course, but I absolutely need parents to consider getting the vaccine because we need you here to take care of your children. And also just trying to keep structure for your children. We are living in unprecedented times, all of us, and our children are really suffering. One day they come home from school and they're told they can't go back to school. They can't go to their friend's house. They can't go play on their sports team. They can't go to see grandma. Everything. I mean, literally, the rug was ripped from under them. And as adults, we're struggling with it. And then children are struggling with it. And it may not be, they may not be able to express themselves. What you may see are signs of depression and anxiety developing. You may see the child who used to be your chatterbox is now quiet to themselves. You see a child crying all the time, or they're angry all the time, or their grades are dropping for two reasons. One, because virtual school is difficult to maneuver, or they're really struggling with the environment that's going on around them. So I tell parents to talk to their children. They see what's going on, and explain to them in simple terms that, there's a virus going around that's making people really sick. And these are the things we need to do to protect ourselves, and then find things to do in your home. Pick up a game of Monopoly, learn a new hobby, do all things in the house, but trying to keep some sense of normalcy in a completely abnormal world right now.
Absolutely. So, Dr. Wardlaw, you have adults in your practice. Do you talk to them about maintaining mental health now more than you did maybe before in the past, where they were just coming in for diabetes or heart disease? Now that we're all kind of have to shelter in place and have these new kind of ordinances and restrictions put on us, are you finding yourself talking more about mental health to your patients?
Yes, absolutely. And that's been one of the silver linings with coronavirus, that patients are more willing to come in and talk about it. Sometimes we have this stigma in the African American communities where people don't want to talk about if they're stressed, if they're feeling depressed, if they're feeling anxious, if they're feeling lonely. Coronavirus, people are more open about having those discussions, which is great for me, so that I can continue that dialogue and offer strategies and additional help when necessary. So yes, we are having far more conversations than we had previously, and we're having them more voluntarily. It's not like pulling teeth. Oh, I'm not crazy. No, I don't need to see a therapist or a psychiatrist. So that has really helped us move in a more positive direction, with realizing that it's okay. We're all stressed. We're all trying to adapt to this new normal. We all have to have experienced some challenges. Maybe it's finances, maybe it's our work, maybe it's our family members, not being able to see them. So again, we are definitely having more patients come in and talk about it more freely, which is excellent. That is definitely a silver lining that I have noticed.
Well, that's absolutely right. And we did actually, I think that was the first video that we did for Medical Moments. We talked about mental health, and then we've done some Facebook Lives on what we call pandemic fatigue. And so we really have, when we're trying to give as much information out about coronavirus and about the vaccine and how can you get the vaccine, we're also giving equal information about how do you keep yourself, not only physically healthy, doing, with exercises you can do at home, but also mentally healthy with just trying to keep your mind and not going crazy, because every day feels like Tuesday when you're home. And these days start running together. So it's very, very important that we maintain our mental health as well. So what do you think are, outside of coronavirus, and we know that's the elephant in the room, but Dr. Wardlaw, what do you think are some of the biggest health challenges facing our community?
Well, one, I think that diabetes is a huge health challenge facing our community. African Americans are disproportionately affected, not only with the diagnosis, they're also disproportionately affected with amputations, with visual changes. So, and diabetes, I think, and patients, we really have to make sure that the health literacy is communicated. Patients are understanding the disease, exactly what it means, the complications of disease. There are many patients that don't understand that you could lose a limb, or that you could lose your vision, or that your kidneys could shut down if your diabetes isn't controlled. So it's many people, many patients do not make that connection. So we have to do a better job as a medical community to make sure that we are communicating in an effective manner and making sure that patients are understanding, so they can become active participants in their care to allow for increased compliance. High blood pressure is another one. Diets and sometimes lack of exercise. And again, we also have to think about the social determinants of health, which also affect, sometimes we have food deserts. People can't get healthy food. Sometimes we live in unsafe neighborhoods and people can't go out and exercise. People don't have access to gyms, and well, no one has access in Philadelphia now. We're shut down, but we have to also be in tune that there are other social determinants of health that are occurring that also have to be addressed. We also talk about, we talked about the mental health. Again, some patients are more apt to talk about it now because, everybody's under stress right now. So those are some challenging, heart disease. Those are some challenging issues that we have to continue to tackle in our communities. And we have to do it as a team. The doctor and the patient has to be a team, because otherwise it's going to be very difficult to get these situations under control.
And for me, obesity and asthma.
Okay.
And as we see more of obesity, and the pandemic has caused some challenges too. What I've even noticed in my household, what I noticed in my teenage boys, I said, when you're in school, you don't get up and go to the cafeteria after every class. But at home, they're in the kitchen all day long, right?
Yeah.
But they have access to it, right? So I said, but I had to realize, and this, again, being a parent has helped me be a better doctor. So I realized that, and I started mentioning it to my parents, and I said, listen, you have to have healthier options. because I don't want them to think that they shouldn't be eating, but they need to be eating healthier options. So you need to make sure that you do have, fruits and water and vegetables and low sugar snacks and things like that in the house, because they're going to be eating all day long. They're going to be eating all day long. So obesity was an issue before the pandemic, and that's becoming more of an issue now. So for me, medicine is big. I want to help prevent it. So if I can teach my parents earlier how to modify their eating habits, then it trickles down to their children. Because if I can't get to the parents, I'm not going to get to the children. So obesity is a big one, which leads to other comorbid conditions later on.
Yeah.
Then, asthma is still one that we struggle with. So trying to manage, our patients' asthma.
Well, you said something there that I want to make sure that our audience hears. You said medicine is good, but we want to get rid of it. We don't want people to, because I think people think that doctors are all about prescribing medicine, and that's not the case. Doctors are about health and get healthy. And so if you could be healthy without medication, that's even better.
And for me, my mantra to my patients are the 3 best ways to maintain your health: adequate physical activity, proper eating habits, proper nutrition, and proper sleep. Those are the mainstays to trying to maintain your health, because again, we don't want you to develop diabetes. We don't want you to develop high blood pressure. We don't want you to develop cardiovascular disease. So we're talking about prevention, because I don't want to put you on medication.
Right. That's extremely important. I think that that's not set enough. There was a question that we had. I'm going to put it here on the screen earlier, and this is about diabetes. So, Dr. Warlord, this might.
Yep.
First, Clyde wanted to say hello, and is the risks the same for type 1 and type 2 diabetes? Over the last few months, some news reports made the point of calling out type 2, and I think he might be referencing to coronavirus.
Okay, so type 1 diabetes is typically diagnosed at an earlier age, where the pancreas is just not able to produce enough insulin to keep the blood sugars under control. Type 2 diabetes, we can see at any age, but oftentimes we see it, and a lot of times it's associated with obesity. It can be associated with other risk factors of high blood pressure. So the diet and the exercise definitely are higher risk, put you at higher risk for, or lack of higher risk for developing type 2 diabetes. But type 1 diabetes you can develop and be doing everything perfectly. It's just that your body is deficient. The pancreas is deficient at being able to produce enough insulin. Type 2 diabetes, we can significantly control with the choices that we make, our diet and our exercise. Type 1, we often cannot do that.
Well, that's great. So I hope that answers the question that was there, and people really need to kind of understand the differences between type 1 and type 2 diabetes. I would say, please talk to your medical professional to get that understanding. You can look up the twin sister docs, and they can give you that information as well. So again, thank you for answering that question, because I think it's important for people. People tend to not ask questions. And so, Dr. McDonald, you talked about this a little bit earlier, but I really want you to kind of get people to understand what it means to be your own or for your child's health advocate, and how important that is for your health journey throughout your life.
It is hugely important. It's hugely important because when you're practicing medicine, you have to work as a team. And when you go in as a patient, if your physician is talking to you and you don't understand, you must speak up, because if you don't understand, you're likely going to go home and not follow through because you don't understand why you're doing it. Mm-hmm. Or if you do understand and you're still kind of skeptical as to, well, why are we doing this and not this? Then you need to ask those questions. And then also, if things are not coming up and you've learned about it somewhere else, you've heard the twin sister doc say, okay, the age for getting a colonoscopy is 45. We're giving you that ammunition or that information to now go have a conversation with your doctor. Doc, I'm 45 now. Should I be getting a colonoscopy? Mm-hmm. Or, I'm in my 40s now. Should I be getting a mammogram? So you should be having those discussions with your physician. And that's what we mean about being an advocate. And at the end of the day, your physician it should be giving you the best information possible based on your situation. And hopefully you have that relationship, because I have patients come in all the time and say, well, doc, why do I have to do this? I really don't want to do this. Can you tell me why I have to do this? And we have a discussion. Or, as Dr. Warlock said, I say, okay, I need them to go outside and get some physical activity. And my patient may say, not in my neighborhood. I can't do that. And for safety reasons. And I say, okay, I understand. I can't keep pushing. You need to go outside because you've given me some information that I need to now make an adjustment for you. So I say, okay, do you have a basement that they can go in with a jump rope, a hula hoop? If it's big enough to ride around with some skates. Now, I'm not suggesting you do it in your living room.
Right.
So, but it's important, when you have that information, even if if just a little bit of information to allow you to ask a question and start the conversation with your doctor.
Can I jump in here, Alex?
Sure.
Can I jump in? Yeah. So, for patients, being clear on what is being said to you. If you don't answer the question, doc, I didn't understand that. 2, making sure that you understand what medicines you are receiving and why you are receiving them. And because again, that increases compliance with patients. And also, you advocate for yourself. If you feel like your concerns or your issues are not being addressed, there are thousands of doctors. Find yourself a doctor that is going to hear your concerns and address your concerns.
Mm-hmm. Yep. And if I can just focus on what Dr. Warlaw said, if you don't understand, speak up. We're doctors. Sometimes we get lost in our own, words that we're using and don't realize that the patient doesn't understand it. And I got to tell people, when I go to the mechanic, he's telling me about the carburetor, the transmission, and the alternator. And really, at the end of the day, I'm like, okay, well, can I drive my car? Can I drive my car? Because I don't understand all of that. But, now I really need to know, okay, can you really simplify it for me? What's wrong? What do we need to do to fix it?
Right.
And don't be afraid to ask for pictures, because pictures sometimes tell 1,000 words that sometimes the conversation is not addressing. And I always try to use visual for my patients. And one that I always use is, good oils and bad oils. And growing up, we all had that can of Crisco on our counters. And
yes, we did.
when that Crisco cools down, it turns into a solid. We put it in the pot, and it melts and turns into a hot grease. Well, we would eat that Crisco, but guess what? We couldn't do with it. Put it in the sink.
Right.
Because your mother would have a fit if you put it in the sink because it would clog the pipes. Guess what? Does the same thing to your arteries. Same thing to your arteries. So people can relate to that a little bit more differently. They can understand that as opposed to you tell them, your bad cholesterol, your LDL, and your good cholesterol, your HDL. They know they can't put that Crisco in the pipes because it's going to clog the pipes. But it's the same thing to your artery, to your heart.
And what I tell my young children when I'm trying to explain to them about cholesterol, I'll simply say, okay, look outside. Tell me how easy it is to walk up and down that street. Now, I want you to think about walking up and down that street after a 10-inch snowstorm. How hard are you working? That's how hard your heart is starting to work if your arteries are getting clogged.
Mm-hmm. Oh yeah. But it just made me I had a flashback of my grandmother frying fatback every morning on the stove and pouring that grease in that can. It was right there. So
we all had it in our house.
I think I still have some bacon grease in my refrigerator right now. It's there, but yeah, that's absolutely a better way of trying to help people understand. Because you're absolutely right. I've heard, even in this position, working a Black doctor, interviewing doctors all the time and hearing the terminology, it took me a while to get used to it. And so I think if I was only going in to see my doctor semi-annually, or just if I had a problem and hearing that language, I would be very confused. And when you're confused, the typical nature is, I'm gonna stop doing it. It's not that bad. And then you learn to live with it. I'm using air quotes on that. And then those learning to live with that pain or learning to live with that discomfort over time exacerbates and becomes a bigger condition when you could have had it treated earlier. If you just, advocated for yourself and said, hey, doc, I don't understand what you're talking about. Can you break that down for me? And it's a simple question. I know it feels hard because you're asking an authority on that, but really being your own health advocate is the best way to a healthier life and healthier outcomes. Mm-hmm. So as we're coming up close here, this time's flown by, but I'd My question, I got two questions left. The first question is, how do we get more African Americans to make that decision to take that long road to go through medical school? How do we get more Black doctors out there in the world?
One, I think we need to be more visible. One, and we have to provide mentorship programs. Mentorships were key for Dr. McDonald and I. We are the first physicians in our family. And so we didn't have anybody who understood the roadmap and all of the guidelines and all of the testing procedures that you have to go through to get to medical school, not only to get there, but to graduate medical school, get to residency. So one, we have to be more visible. Our societies, medical societies are key. They provide mentorship, the NMA, the Student National Medical Society, the Medical Society of Eastern Pennsylvania, which is the local arm of the NMA in our area. So we have to make sure that mentorship is there. We have to reach back. We have to let people know that we are here to help you. Because again, it's not that many of us. Dr. McDonald and I, we are African American women. We represent 3% of the physicians in the United States. So and African Americans in general represent approximately 5% of the physicians in the United States. So we have to do a job of making ourselves visible, making sure that we have programs where students are available to us, making sure that we are available to ask questions. Because again, it's a challenging road. It could be a challenging road, and not knowing which way to go, which direction to go, not knowing how to get a recommendation or a reference letter. So all those things are important, and we have to make sure that we are reaching back and making ourselves readily available to help those who are interested in going in the field of medicine.
Absolutely.
Mm-hmm. And there needs to be more programs out there that expose children at a younger age, more STEM programs. Programs in our schools, to get children engaged early on, to become interested in medicine. All of that is extremely important. And what we tell people is the road to medicine, the days are long, but the years are short. I feel like I just graduated from medical school. But yesterday was actually 20 years ago.
Well, it is a life of learning, and you have to. I think that's the key from what I've witnessed from the doctors that I know and that I've interviewed. All of you all seem to have a lifetime love of learning, because you have to continue to not only helping people, but you also have to continue to learn about your craft and what's new and what's out there, and how technology is helping and people get better. And so that love of learning and that love of helping people is really driving that. If we can instill that in more and find ways to cultivate that in our youth, I think we could develop more Black doctors, definitely. So thank you for that. Final question: what's next for the Twin Sister Docs? What's on the horizon, and how can people get in contact with you if they want to learn more about you?
So Twin Sister Docs will continue to provide quality health care to our underserved patients, but we also want to continue to be healthcare advocates for healthcare, encouraging people to take action in their health and continue to shine light on identify the healthcare disparities and help identify ways to bridge that gap. Because that's extremely important. We're looking to amplify our message on a national and a global platform, through lectures, through commentary, through interactions such as this on social media, because it's extremely important for us to continue to push that message, and for African Americans and anyone else to get comfortable with the medical establishment. And you can find us on Twin Sister Docs on Instagram, Twitter, and Facebook. Dr. Wardlaw?
Absolutely. And again, we just want to continue to promote health, wellness, and self-advocacy, because again, we're learning that we have to be able to feel comfortable with speaking up with ourselves so that we can get the attention that we need. Dr. McDonald and I also are having discussions with corporations and companies about how to address implicit bias, because it is a systemic racism, and implicit bias is a system-wide problem. It's not just an individual problem. So these systems need to be implementing policies and procedures so that everyone is aware that is unacceptable, making sure that there's a standard of care that is provided to everyone when they walk through the door, regardless of their sex, their age, their race, their ethnicity. So again, working on that level as well to make sure that those issues are being addressed in a systematic manner, because it's not just one person; it's a system failure.
Yeah. We are looking to partner with grassroots organizations, corporations, so we can continue to keep this message coming.
Absolutely. Well, you always have a home right here on blackdoctor.org, and we know we're going to have you back coming in 2021 in the future. So, because you all are so inspirational for our audience and for even our youth to really see, hey, it can happen. You're not alone out there, and that there is a path, there's a career path, and we really need more information, people like you that can break it down, because medicine can be difficult, and especially when you read those pill bottles and they got all these fancy names and you're like, well, what does this do for me? Like, and understanding the classes of medicines, like something as simple as an anti-inflammatory, but there are several of those that if you just know, okay, all of these are in the group of anti-inflammatories, well, then that feels better. But they keep just giving you all the naproxen here and this and Motrin there and other. People don't recognize that they have the same function. So if we can get that information broken down by the twin sister docs, I think we can live much healthier lives. So I want to just say a couple of thanks before we get out of here and let y'all go back to your Sunday afternoon activities. I want to say thank you to BMS, Bristol Myers Squibb, particularly Anthony's Fields. I believe I want to say her last name properly, but she has been an inspiration in terms of putting this project together with the Medical Moment. So we're going to have some more videos out there for Medical Moment. So just stay tuned for the videos, because I think it's important for doctors to speak directly to our audience and let people know the misinformation out there, because you got to hear directly from doctors. And then you can take that information and like they said here, go to your physician and say, well, I heard this from on Black Doctor. Is this true? And you can challenge your doctor. And if you don't, feel like what they're saying to you is true, get a second opinion. That's okay as well. So really be your own best health advocate. And I think both Dr. Wardlaw, Dr. McDonald has expressed that in no uncertain terms today. So thank you too for joining us today. I want to say, everybody, please go follow Twin Sister Docs. Okay, you're going to get all the information you need right there, North Philly. That's where the Fresh Prince is from. That is where Twin Sister Docs is from.
He's from West Philly. We don't claim him.
He's from West Philly.
West Philly.
He's from West Philly. Okay, all right. So I'm sorry. I'm about to start singing a song up in here. But thank you too for joining us today. You have been a delight to talk to, and the audience, they didn't ask any questions. They've just been singing your praises the entire program. So you all are doing great. Beautiful smiles. Thank you all for joining us, and we look forward to speaking with you again in the near future.
Absolutely, everyone, please stay safe, and we're honored to speak with you today.
Absolutely. Okay. Wear your mask. Wash your hands. Watch your distance. Get your vaccine when it comes available to you.
Out of your home.
Yeah.
All right.
Y'all take care.
Have a good one.